Hi everyone, welcome back to my YouTube channel. Today we are going to talk about anatomical planes. So let's start our topic with introduction. Anatomy is study of structure of human body, and to describe the position and movements of body parts accurately, anatomists use standard reference system. One of the most important of these systems is concept of anatomical planes. These planes are imaginary flat surfaces that divide the body into different sections, allowing healthcare professionals and students to describe locations, relationships, and movements with precision. Concept of anatomical position. Before understanding anatomical plane, it is essential to know the anatomical position, which serve as a universal reference point. In this position, body is standing upright, feet are together and facing forward, arms are placed at the sides, and palms face forward with thumbs pointing outward. This standard position ensures consistency when describing planes and directions. Major anatomical planes are sagittal plane, frontal plane or coronal plane, transverse plane or horizontal plane, and oblique plane. And you can see these planes in the diagram except for the oblique plane. Now let's talk about these planes one by one. So first is sagittal plane, as you can see in the diagram. It is a plane that is in vertical direction. It divides the body into right and left portion. Or we can say the plane that divides the body into right and left portion is the sagittal plane. When this plane passes exactly through the midline of body, it is called the mid-sagittal plane or also the median plane. But when it divides in the body into unequal right and left parts, it is called parasagittal planes. Examples in practice are movements such as walking, running, or nodding the head that occur in sagittal plane. Next major anatomical plane is frontal plane, that is also called as coronal plane. Frontal plane is a vertical plane that divides the body into anterior and posterior portion, or the plane that divides the body into front and back portion is frontal plane. It runs perpendicular to the sagittal plane. Examples in practice are jumping jacks, side lunges, or tilting the head sideways are movements in the frontal plane. Next anatomical plane is transverse plane, that is also called as horizontal plane or axial plane. It is a plane in horizontal plane that divides the body into superior and inferior portion, or the plane that divides the body into upper and lower portion is transverse plane. It runs parallel to the ground when the body is in anatomical position. Examples in practice are rotational movements such as twisting the torso or turning the head that occur in transverse plane. Next major anatomical plane is oblique plane. Oblique plane is any plane that divides the body at an angle other than 90 degree to the sagittal, frontal, or transverse planes. It allows the study of structure that do not align with the major planes. Examples in practice are MRI scans that are often used of oblique plane to provide better imaging of certain organs or tissues. Clinical significance of anatomical planes. Understanding anatomical plane is not only important for descriptive purposes, but also for practical applications in medical imaging, as X-rays, CT scan, and MRIs are often taken in specific planes to visualize internal organs clearly. It has practical application in surgical procedures, as surgeons use planes to plan incision and approaches to internal structure. It has practical application in physical therapy and sports sciences, as movements and exercises are categorized based on planes to design training programs effectively. It has practical application in communication and healthcare, as anatomical plane allow precise and universal communication between healthcare professionals. Conclusion of this lecture video. Anatomical planes provide a systemic way to describe the human body structure and movement. Sagittal, frontal, transverse, and oblique plane form the foundation of anatomical terminology and clinical practice. Mastery of these concepts is crucial for students, healthcare professionals, and anyone studying human anatomy, as they ensure accuracy in understanding, teaching, and applying anatomical knowledge. And this was all about anatomical planes. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.